Good Friday, everybody. I hope everybody is having has had a great week so far and is really excited about their weekend ahead. I'm pretty sure every student is excited to take a break from any kind of homework or other kind of learning place, but we'll just kind of snab you for a little bit longer to have you do some virtual learning. So today we are joined by the fabulous Rami Leventhal. He is one of our simulation faculty within the College of Health and Human Services. He is always a real treat every time we have him do any presentation, and we are really excited because today he's going to give us a virtual tour of the simulation center and kind of just give us a run through of all the different rooms since you guys cannot be at the simulation center in person. So we're really excited and please enjoy. If you have any questions, feel free to put them in the chat. We can ask those. Otherwise, we will have a Q&A at the end so you can save all your questions till then. All right, over to you, Rami.
All right, good. All right, welcome everybody. My name is Rami Leventhal, and I'm super excited to give you a synchronous tour, even though you're not here, over a fabulous simulation center instead of sitting at home and talking about it and showing you pictures and videos. This will be a little more fun. I want to apologize in advance. So it's just me here, and I put the computer on a rolling cart. So what I'll do is you'll see me flipping the camera back and forth as we go through the simulation center. So bear with me as we go through doorways. We're going to have some bumps that might shake your image. I'll try to minimize those, and I hope you really enjoy this tour, and we'll definitely have a chance to talk about it at the end. So starting here, we're starting at the lobby here. This is our St. Elizabeth Healthcare Inpatient Simulation Center. Our center is actually a two-story facility that mimics a virtual hospital. St. Elizabeth were very generous. They donated $8 million to develop this simulation center. And you'll see how it really looks like a hospital or critical care area. And the intention behind it is to prepare the healthcare providers of tomorrow the best way we can. So our students here on our health science building come from all different disciplines. We have nursing students, radiology students, radiation therapy students, respiratory therapy, athletic trainers, anesthesiologists. So we have a very, very big group of different students that are using this facility, which is really exciting. So what we're going to do next, I'm going to walk you through, we're going to stop at our first stop. We'll talk about what we see, how our students use it, and we'll have virtually interact with one of our mannequins as well. So if you guys are ready, we're gonna get going. All right, so we're gonna walk from our lobby here. We have special effect cart sounds. We're gonna stop at our first stop, which is our operating room. I'm gonna clap my hands for the lights. Ta-da! All right, so what you're seeing here is our operating room. Primarily our nurse anesthesia students use this space a lot. I know that you see a lot of different equipment in this room. And what we pride ourselves a lot is every piece of equipment you see here is real. We don't pretend, we throw that word out. So we buy, borrow, steal, and procure different pieces of equipment so our students can utilize equipment in real time, just like they would in the hospitals. So if you look, I'm going to take you closer here. You can see this is a real ventilation machine. This machine was actually, when the COVID pandemic started, was donated to St. Elizabeth Hospital to use in case they need it. They just returned it because they have enough and they don't see the need for it. But we have a really nice partnership with it, so we can, even that can help in a time of crisis. So the ventilation machine is actually used to breathe for a patient when they go under surgery, meaning when the nurse anesthesia puts them to sleep with drugs through the IV, they control their respiratory efforts with this machine and make sure that they're well taken care of, that their breathing pattern is okay. This machine helps them do that. You can see on the, I posted on the big screen. Let me back up so you can see it. You can see there is these two big giant screens. And what you see on the screen there, and I'll flip the camera so you can see it a little better, is those are vocal cords. So we have these giant big screens, and every room is equipped with microphones and cameras that allow us to capture everything and zoom in high fidelity and high definition. So students, when they perform a different task, they can look at the screen and see what they're doing. So I just put an image of an example of what they would see with a mannequin or with different mannequins that we have that they can do this with, or even humans. When they use video laryngoscopy, they can look through someone's mouth, and that's your vocal cords. That's what they put an intubation tube in to breathe for you. So just an example of what we can use this equipment for. Right behind me, you see the big wall of mirrors. So every simulation room we have has these big mirrors, which will go into that room in a second, because it wouldn't be realistic for students to come in here and participate in the simulation activity with us, the faculty or their teachers, standing in the room and watching them. So we actually immerse them in the environment. They're on their own here, critically thinking, making decisions on their own in real time with a patient in the room, if it's a mannequin or actor, which we'll talk about in a little bit. And we sit in the control room right behind these mirrors, which we'll walk to next to show you what that looks like. Now try not to kick the cart as I go along. So you can see here is the control room. So obviously you can't see this in from the simulation room, but this is where a simulation technician will sit in a computer and control the mannequin, control the cameras, the microphones. So it's kind of like a production studio, very, very similar to that. They have access to a lot of different technology to control the lighting, the cameras, the microphones, the video quality, but also the complex mannequins that you'll meet in a little bit. This is also where the faculty will sit and watch everything unfold, and their focus is to make sure that whatever we're doing in simulation matches their education objectives. So that's one of our many control rooms. Every simulation room we'll see will have one of these control rooms. So we're going to move right along. We're going to walk into one of our many patient rooms, just to show you some setup. So here I wanted to stop here just to show you a simulation that's set up for later today. Actually, we have nursing students in their second year. They're going to come here and take care of this patient. What you see in the bed is one of our high fidelity mannequins. These mannequins are run anywhere between $60,000 and $90,000. They're really expensive because they're physiologically based. You'll see in a little bit, they can actually respond to interventions. They can talk, they can blink, they can bleed, they have pulses, they breathe. So they act like you and I. The reason we use them, and actors, we have to use mannequins for any physiological problem we want to convey to our students that an actor can't do. So of course, an actor can't have a bleed, or an actor can't receive injections, or can't have a tube put up his nose like this mannequin. So we use our actors more for the communication and the psychological communication between patients and their care providers. We use the mannequins a lot more for the physiological conditions, or sick or traumatic patients that require interventions by the students. So here, if I get closer, you'll see that this patient's hooked up to a feeding tube that's going through his nose. And there's actually liquid that can actually go through the tube in the nose that goes to his stomach. He's also hooked up to an IV pump. You see there's an IV pump with fluids going through his IV in his arm. If I get a little closer, you can see the IV in his arm, and it's an actual IV. So they can actually infuse drugs and medications in real time into this mannequin. So there you can see that. And the mannequin can actually record and document how much fluids and medications they gave the patient, and actually interact and have responses to the medications or intervention they performed on them. Back here, you could also see that the patient is attached to a monitor where you can monitor a lot of their vital signs. And the vital signs will be manipulated by the simulation technician in the control room. So a lot going on here with this patient. And they're going to practice taking care of this patient in a couple of hours. The way a simulation runs, so typically we have groups of 8 to 10 students. If it's nursing students or athletic training students, doesn't matter the discipline. And it wouldn't be very realistic if we threw them all in here to take care of this patient. Usually it's just 1, 2, or maybe 3 of them coming in taking care of the patient, while the rest watch it happen live in one of our debriefing rooms, which we'll go visit a little later. This allows them to communicate with each other, communicate with the patient, critically think and make decisions on their own in a realistic environment, because they're not going to be 8 of them taking care of a patient in a hospital. All right. So we're going to move on to another area. So this is a big trauma bay, or one of our most used simulation rooms. You can see it's quite large, and this wall in the middle can actually be opened up, and it could be split into 2 rooms. Again, you'll see these mannequins set up here for simulations. And what we're going to do now, I'm going to park this nice gentleman here, and I'm going to go to the control room. I'm going to turn a simulation on, and I'll have him talk to you a little bit instead of me. Sounds good? I'll be right back. Hello, and welcome to NKU's Center for Simulation Education. I am Simman, a high-fidelity simulation mannequin used to simulate real-life experiences for our students. As you can see, I can breathe on my own, my eyes blink, and I can talk to you. So let's get started to learn more about me. Can someone please feel my radial pulse? If you're not sure where to look, here's a picture of where to find it. So I'm going to feel his radial pulse so he can tell us a little more about himself. Great job. Students can feel my pulses in my arms, legs, neck, and groin. They can also listen to authentic heart, lung, and bowel sounds, and even listen to blood pressure on my arm. I am physiologically based, which allows me to mimic real-life conditions that a real patient might have. Students can evaluate my vital signs and my physical condition and make decisions based on what they find. So let's talk about the different vital signs they can find on me. Can someone please feel my pedal pulse? If you're not sure where to look for it, here's a picture that'll show you where to find it. Right, so the pedal pulse is in his feet. So this is an example of how he physiologically responds to something I'm doing to him. In this case, it's a simple action of just feeling the pulse in his foot. Great job. If you look at the patient monitor, you can see that it's displaying a variety of different vital signs. Students can evaluate these real-time values and check my heart rate, EKGs, respiratory rate, blood pressure, oxygenation level, and temperature. So let's make sure that my oxygen levels are okay. Can someone please grab the pulse oximetry probe and put it on my finger? It is attached to the monitor and looks like this. Great. It looks like my oxygen levels are where they should be. Thank you so much for taking the time to learn a little about me. And please, if you have any questions, feel free to ask your facilitator of this tour. Have a great day.
Rami, we have one question.
Yes.
Victoria asked, you said that the mannequin records all the injections. Mm-hmm. Are you able to kill it?
Yes. So what's very interesting is a great question. So these mannequins are very high tech and are physiologically based. So they won't let you not make sense. So for example, if I'll use something common, let's say my mannequin is having a heart attack and they're losing their ability to breathe and losing their pulse. If the students are not performing quality compressions and bagging him, providing him with oxygen and breathing for him, he will die. So a lot of things like that are built into the system, the software, that we can manipulate and design too, but they're also naturally fed into the software. So for example, he's not gonna not have a pulse and breathe because that's not physiologically possible. So yes, so if we program a scenario where he's having an allergic reaction, requires an injection of epinephrine with an EpiPen, so an injection example, and 5 minutes pass and they don't provide him with that injection, his airway can shut down. So there's a lot of different complexities and examples that we can use that for, but yes, they can die. We try not to do that, but it is an important discussion to have with students because all of our students are going to be working in healthcare environments where unfortunately bad things happen, people get sick, people do die. So we do actually have a simulation for our nursing students and our social work students where they have to deal with a patient that is dying. So it is an important topic to discuss. And yes, a lot of bad things can happen in these mannequins, which is a great question because it really explains why we need these high fidelity mannequins that can perform all these tasks that an actor cannot. Does that answer the question?
I think so. No other responses here, but we'll see. Sometimes it takes longer to type.
Yeah, good. So we're going to go over to our next little area. Say goodbye. This will be interesting because I got to push through a doorway. All right, just wanted to give you a little view of our beautiful campus here. Even in the winter, it looks pretty. But here, this is one of our debriefing rooms, which we'll talk about a little bit. So you saw a lot of the different simulation environments like the operating room and the patient rooms and the big trauma bay area. And those are intended to provide all of our students with the simulation experiences. We work hard and spend a lot of time setting up those experiences so they're as realistic as possible for our students. But where the learning happens is after the simulation. We have a lot of these different little debriefing rooms that are right across from the simulation rooms. So this is where the rest of the students, remember we talked about if we had 8 or 10 students, that 2 of them would go in there and the rest would sit here. We'll actually stream it live on the screen so they can watch as things unfold and be active participants in that activity. When the simulation is over, the participants and the people who watch it sit here together and with the faculty member, kind of like peeling an onion, they peel the layers of what happened and talk about it in a constructive way and debrief the simulation activity. So they talk about how they felt, what they think went well, what they think they can improve on, and have a very valuable quality discussion about that experience. And that's where the learning happens. They all walk out of here, learn something new, or have a new learning experience from that. What I have here, the last part I wanted to talk about is, you can see we have one of our 12 CPR mannequins that are not just a little CPR dummy. They actually respond to compressions and ventilation. So they're very high-tech Bluetooth CPR mannequins. And these are very, very, very important to our facility because we want to make sure that all of our students perform quality CPR when they graduate from here. So we certify them here and make sure that the quality continues. But we also have a new project called the Heart Saver program, where we want to get as many people from our community around us certified in CPR and first aid and AED use. So it's a Heart Saver course. So any member of our community can come hopefully once the coronavirus pandemic leaves our society and our culture, we want to bring community members here to get certified in quality CPR, first aid, and the use of AED, because we strongly believe that the more community members we have certified, the more lives we can save. And that's what drives us to come out with this project to get community members certified, is that unfortunately Kentucky is the 8th worst state in the country when it comes to survival rates from cardiac arrest. So 9 out of 10 cardiac arrests happen outside of hospitals, like in a mall, the street, or someone's home. And unfortunately, we don't do a very good job in our community in performing high quality CPR and helping save more lives. So this is a big initiative on our part. And as soon as COVID leaves, we will bring community members here, as many as we can, get them certified, provide them with quality course and materials and education so they can go out there and be confident and competent in CPR skills. And this mannequin, for example, just to give you an example, nice visual, looks better than just talking about it. So I'll get close to the screen so you can see it. Like that. So on the screen, maybe I'll switch the camera around so you can see it better. No, not better. Sorry guys, I'll switch it this way. So on the screen, you can see feedback. And as I'm compressing my mannequin here, I'll move my mannequin up so you can see it. You'll see that it's measuring my level of compressions, how deep I go, how fast I go. So the participants in these courses can actually see objectively how well they're doing, and it'll grade them and tell them how they're doing.
Rami, we have a question.
Yes.
It's what does it cost to get CPR and first aid certified?
So excellent question. What we did is we got a grant for this project. So if you're a community member, if you're a high schooler from this area, once this pandemic passes, we're going to start getting you guys in here. And the cost for you guys will be absolutely zero, nothing. So we got a grant that covered the cost for our certification cards, our equipment, our books that we provide. We got a generous grant for that that allow us to certify 100 community members. And of course, once we show success with that, which I know we will, we'll grow that and hopefully get another grant and increase that and get as many people from our community, especially high schoolers, certified. My goal, hopefully in a few years, is get all the high schoolers in the Northern Kentucky area certified. So I'm excited about that. And you can see I scored a 0 on my CPR performance. But great question. So no cost to community members. And for our students, it's a very reduced cost. Students and staff pay a very minimal amount to take this course and get certified. All right. So that, in a nutshell, concludes our little tour. I know there's a lot more to show, but I just want to give you a little taste of what we do here. And I definitely want to open up and leave plenty of time for questions and talk about anything you want related to our activities here.
So you can put your questions in the chat, or if you want to, you can unmute your mics and you can ask them directly to Rami. So feel free to begin asking questions.
Don't be shy because I can't see you, right? So.
Sometimes it does take people a little longer to type things out than to unmute. So if anyone wants to unmute while someone else is typing out a question, this would be a great time to do that.
And I hope everybody heard okay through the mask. I was trying to be as loud as obnoxious as I can.
Maybe while we're waiting for people to ask questions, could you talk a little bit about the importance of the simulation center for the students on campus?
Absolutely. So that's a great question. The reason we have all this, the reason why St. Elizabeth invests in this and why NKU invests in this is to as much as possible reduce serious safety events in healthcare moving forward with the clinicians of tomorrow. Unfortunately, this is a fact, and it's still a fact, is that the third leading cause of death in the United States is medical error. So cancer, heart disease, and then medical error far outweigh any other things that kill us in the United States. And the leading cause for medical error are breakdown in teamwork and communication, and issues working as a team in the healthcare environment. So our main goal is to not only prepare our students to be good clinicians and be proficient in their skills as they move on to careers in healthcare once they graduate, but also to help them work in a critical environment with communication, working with other team members, going through difficult discussions, difficult situations. So ultimately we can reduce those serious safety events that happen in hospitals, clinics, and other places in healthcare.
All right, we got a few questions. So the first one was accidentally hit it and it went all the way up. So do students have to have any certifications before doing simulations?
Sort of. So any of our students that actually enroll in our college and do a health science program, they get CPR certification. Most of them do. So they have to get CPR certification before they start their program. Aside from that, no, there's no special simulation requirement before coming here. All they have to do is we have a safe gas use policy we use because they actually use real oxygen in here. And we have a user agreement form they have to sign. It just protects them and us because we pride ourselves in being a safe learning environment here, which means we don't ridicule or test them or judge them on their performance. Kind of like the Vegas rules. What happens in the simulation center stays in the simulation center. And we also have the faculty members that come with the students sign the same document. So everybody's in agreement that this is a safe learning environment intended in growth and learning in a positive way, not in a punitive way.
So I said that you were a simulation faculty. We do have a question. They want to know, do you teach simulations at NKU? I feel like I can kind of hone that because I already answered it. So what simulations do you teach?
So great question. So there's a handful of us that are simulation faculties here. And we have 3 of them dedicated to the nursing curriculum. So the nursing program is our biggest program in the College of Health and Human Services. So it takes a lot and they have a lot of requirements. So we have 3 faculty members dedicated to that. Myself, I'm dedicated to pretty much anything that's not nursing. So I work with faculty and teach simulations with athletic training, kinesiology, respiratory therapy, radiation therapy. And actually, we also branch out. We're very proud to promote us being a simulation center for everybody, not just health sciences. So last year, we actually started a initiative with the School of Business, and we did simulations with the School of Business, and not healthcare related, but we used our facilities and our modality to facilitate really cool business simulations where students had to interview clients one-on-one and dissect those experiences. Aside from that, as a faculty member, I also teach a class. So in the Honors College, I teach a class of simulations in healthcare. It's an elective that a very experiential class that the students here love. And and this is just to talk a little about that. In that class, they learn everything about simulation modality and pedagogy, and they actually develop a project, a simulation project, where they facilitate from scratch a simulation program from start to finish. It's very, very cool.
What was your career path?
Long. Not to age myself, I started as a combat medic in the Israeli military. I was a combat in the combat infantry brigade, and that was in the 90s. So that was my first dip in the healthcare world, and I fell in love with it. Since then, I worked as a paramedic in EMS here in Cincinnati, then for a few years, and then worked for over 8 years at Cincinnati Children's ER. They actually use paramedics in the ER there, specifically in the trauma bay, and that was a great eye-opening experience. During my time there, I went back to school and got my undergrad and graduate degrees, and now here I am teaching. So that was my career path. A lot of years as a paramedic, still a paramedic, but now I teach. I don't practice anywhere.
So going off of your EMT/medic background, we have someone who said that they're wondering how you got into it, which obviously your path is going to be way different than the path they would take. But they also want to know, like, since it's something they're interested in pursuing, how they could go about doing that here.
That's an excellent question. So obviously in healthcare, there's a lot of shortages in EMS and in nursing, and you have to love it. I'll be the first one to say that there's not a lot of money in emergency medical services, EMTs or paramedics. You have to love it. What's nice about it, there's a lot of schools around us that have EMT courses. They're typically about 4 to 6 months. And they're not difficult. They're kind of packaged nicely. And once you complete the EMT course, you get certified as an EMT basic, either Ohio or Kentucky. You also are certified nationally, so it allows you to work in other states as an EMT. And a lot of schools, you have to work as an EMT for at least 6 months before applying for a paramedic program. So you'll definitely get an idea if it's something you like to do or something you're interested in. And I've met so many people that were either nurses or other professions that were EMTs and then picked a different career path. So an EMT is kind of an entrance into that type of healthcare world, like emergency services. If you love it and decide to go to paramedic school, paramedic program is one of the toughest programs, college programs. It's a year long, and it's very condensed. You have to complete the certification within a year. Unfortunately, nationally, the pass rate for the national exam for paramedics is still in about 67, 68%. So it's a tough course. But if it's something you want to pursue, I loved it for all the years I've done it. It's a very rewarding career, and you learn a lot. When I first graduated as a paramedic, I thought I knew a lot, and the years of experience in the field or in a hospital really grew me as a healthcare professional. But if a path you want to pursue, I'll definitely recommend taking the extra step to get certified nationally, so it opens doors not only in the community you work and serve. If you want to move and work somewhere else, you can do that.
All right, they said thank you. So we have one question. They live in the Lexington area and would like to renew their CPR/First Aid certification, where they could go to do that.
So I'll say that the American Heart Association is by far the biggest CPR organization in the world. So I'd say if you want to get CPR certified, make sure it's an American Heart Association accredited facility or site, because any hospital, any EMS outfit, if you show them that you have an American Heart Association CPR certification, that's the that's the trump card, if you will. There are other organizations like American Red Cross and some others, but they're not as widely accepted as the American Heart. The reason for that is American Heart Association actually develops the science behind why we do what we do for CPR, and then the rest just follow suit to meet that. The easiest way to get a CPR certification is one, find a heart saver program like ours. There's some, you have to search for heart saver programs that around you. Some of them are free, some of them are at cost. Usually they're roughly about $50, $60. And if you go to American Heart Association website, there's a lot of them. You can actually search for courses in the area. I recommend the easiest way to do it is to go on the American Heart Association site, do an online module. It's a little cheaper. Once you complete the online module, all you have to do is find an American Heart Association site, and they're everywhere, especially in Lexington as well, where you can go and just test out, and you test your skills and you get your certification. But typically it's about, between the skill testing and the online module, you're looking at about $50 unless you find a free program. Does that answer the question?
I think so.
Just make sure it's an American Heart Association certification. There's a lot of scammers online, so be careful.
Yeah, they said that answered it. We have another one. What is your favorite part of teaching simulations?
Oh, it's probably my favorite part is seeing the students when their light bulb goes off. I absolutely love it. So you'd think it'd be something to do with the simulation experience, but my absolute favorite part is when we sit in the debriefing room and they have that discovery moment. It's like, oh, that makes sense. And probably the top on that, my favorite part is when we end a debriefing session, we go around the room, we ask every participant, what's their take, or what did they learn from that experience? And that's my favorite part, because they come in with a certain amount of comfort or competence and confidence in a certain skill or area, and they leave here learning something new. And that not only from a textbook or a lecture, from an experience, they learn something new from an experience. And that to me is gold. I love going around the room and saying, okay, what's your big takeaway? Oh, I learned why oxygen is so important for a patient with this condition, or something like that. So that to me is my favorite part.
Don't have any more questions yet. Do you want to discuss your heart saver? Like go into more detail about that? Because you mentioned it.
Yes.
But I think that would be really awesome if you could kind of provide a little bit more detail about it.
Yes. So because of COVID, unfortunately, we're kind of at a hold. We're frozen until we get the green light that we can bring community members in. Once that happens, we'll publish on our site and our community sites and invite high schools, specifically high schools from our area, from the Northern Kentucky or greater Northern Kentucky area, to come and take the course. The course is called Heart Saver. So it's a course intended for community members, so you don't have to be a healthcare professional for this. It's a 4-hour course where you come, you learn about CPR, you practice CPR with the fancy equipment we have here. You learn about some first aid treatments. You learn how to use an AED. You learn how to use an EpiPen for someone with an anaphylactic reaction. You learn about Narcan, what to do with that. So it's a 4-hour course where we teach you and we provide you with the ability to practice those skills, and we certify you as a heart saver. The Heart Saver certification is kind of a little umbrella for a community member that is CPR, AED, and First Aid certified. It's a great course, and you really get a lot of hands-on during the course. We're not just sitting in the class for 4 hours and watching videos. You practice these skills and test out on them. So I'm really excited about it. Again, because we got a grant, we were trying to aim for 100 high schools around us, and it's going to be free. So as soon as we get the green light, we will Cameron and Amanda from the IHI will help us, but we're going to publish this, and I'm sure we'll fill it up within days. But I'm really looking forward to that.
Does anybody else have any questions? What's been your favorite teaching moment? You kind of told us what your favorite part of teaching is, but is there like a moment that stuck with you, whether it be with a student or something like that, that's really kind of like not
Yeah.
just an over-encompassing light bulb, but the actual moment?
Yes, and it's very fresh actually. So the Simulations in Healthcare is a new course we started here at NKU, and it's been very successful. And just this past week, our students in groups are presenting, and it's a big part of their grade. So they actually spend an hour, unfortunately online, presenting their simulation project. And that to me was my favorite teaching moment. It was seeing that what I've done all semester worked, and they actually applied what they've learned the entire semester, and they looked so professional and they did such an amazing job. And a lot of these students are not healthcare providers. And this last presentation a group did was they were teaching the class in a simulation project about stroke and how to recognize it and what to do for it. And they did an incredible job. And to me, that was my favorite part so far of teaching is seeing the product of our labor, me as a teacher, but also the class getting to that point. And knowing that they're completing a semester with a little spot in their brain that has that knowledge in it. So I'm really excited about that.
Okay, you have a comment. Anthony says that it looks like you have a really nice facility for preparing students in the medical fields.
Yes, thank you. We appreciate that. We're very happy and very proud to have this facility. We have schools from all over that actually come and spend time in our simulation facility because it is like a two-story hospital in a way. And we're really lucky and happy to have it. I will say that if you're interested in nursing, this is the leading nursing program in this area. And in many different articles and different publications mention this nursing program as being top notch. So just consider that if you're thinking of a career in nursing, this is a place to be. And we have such a close partnership with St. Elizabeth. A huge, vast majority of our graduates go work for the St. Elizabeth healthcare system. And it's not that they come here and sit in class and recruit them. It's a very organic, natural process because they're spending all their clinical time there. And another advantage for a lot of our students here, not only from nursing, because we have the partnership with St. Elizabeth healthcare system, they have an open door for their clinical experience. So we don't have to fight and wait in line and fight other schools for the clinical experience. It's a big bonus. So if you're interested in other healthcare career paths, just think about that too, that your clinical experience is going to be amazing here.
I think I don't have any more questions. I'll tie up, and then if another question pops up, we can have you answer it because we've still got 9 minutes left, so we got some time. First, I want to thank all of you guys for joining us today. It was a real treat. We got to actually see campus for some of us who actually work at campus. We haven't got to see much of campus at all. So that's always nice. And plus we were also able to give you guys a tour of the simulation center, which probably hasn't been done since COVID pretty much closed campus. So you guys actually got to be one of the first people to see the simulation center via tour for a while. So that was pretty nice. Going into the weekend, please be safe. I know that a lot of stuff is happening around us right now. So just be very observant, make sure you're practicing social distancing, wearing your face mask, and just enjoying yourself as much as you possibly can without putting yourself at risk, as always. And thank everybody for coming today, for signing up for all of our virtual field trips that we've had throughout this semester. It's been a really great semester, and we've had a lot of really great presenters, so that's been awesome. And lastly, I want to thank Rami because he's been a really big, awesome help. He's done 2 of our speaking series this semester for our virtual field trips, and we've enjoyed both of them. So without further ado, if there are no more questions, I will release everybody to either go back to their schoolwork or begin their weekend, or at least go have lunch. So thank you all again for coming, and we look forward to seeing you guys for our spring virtual field trips. So be on the lookout and check our website for those. They'll begin populating here in the next few weeks, if not month, so you can come and join those. So thank you very much.